Now, over 200,000 people in Ireland suffer from type 2 diabetes, with most people entirely dependent on medication to manage the condition. But can you reverse it through your diet? Well, Dr. Eva Orsmond says yes.
Dr. Eva joins us now with John Dalton. John, you have lost 8 stone, over 8 stone.
Nearly 9 stone now.
And have seen an improvement in your health.
Well, I'm in good form anyway.
And
despite the fact that she had written me off when I seen her first, she said I should have been dead at that stage.
Because you did have type 2 diabetes.
I did, yeah. I had it for about 10 years previously, and I was on insulin, a high dose of insulin, for about 5 years previous to going to Dr. Eva.
And she put you on a diet plan?
Put me on a diet plan.
Before you got to see Dr. Eva, what had your doctor said to you?
Well, basically, they just kept giving me the medication, and I got so good at it. I used to up the insulin if I was having a bad time.
You could judge it yourself?
Yeah.
Yeah, but he was saying that he basically would put more insulin if he ate badly. Yeah. If he wanted more food, he just injected more.
You were self-medicating, in other words?
Well, no, but that's what they are telling to people, to inject for normal living. And what is normal living?
And John, were you given any other options? Was it like, OK, you've got type 2 diabetes, this is it, this is your lot?
Well, I did think it was a life sentence. I didn't expect ever to get off the insulin, you know.
OK.
I knew I had a weight problem. I knew that I was over 26 stone weight when I went to Dr. Eva.
Now, just before we go any further, you're a big man. You're what, 6 plus? OK. And what are you at the moment?
17.
17 stone?
Yeah.
OK.
Still a good bit of weight, but nothing compared with what I was.
Yeah, but you're actually looking good, Nick.
Oh, I'm not too bad.
Now, this picture that we have here is of you. Oh, there's the after.
That's
Can we go back
after.
to the before picture, Neil? Because I want to see this. What weight were you on this picture?
I would have been around 26 stone.
Wow.
When I went to Dr. Eva first, she asked me what weight was. I said I'm about 24. Stepped up on the scales, I was over 26.
And what did you go to Dr. Eva for? What exactly?
Well, I seen her ad in a local parish newsletter to lose weight, basically. And I had to sort of decide. I had just retired from work, and I decided I'd do something about my weight.
And did you know the weight was connected to the diabetes?
I didn't really know that. No, I actually thought the diabetes was a lifetime sentence, and I didn't expect it. I basically wanted to lose weight for my own health reasons. Although I had no health problems, I knew that it was going to catch up on me. And
did your doctor say to you at all that the weight, the excess weight...
They sent me to dietitians and everything, but it never made much of an impact.
And they didn't say to you, do you know this excess weight has probably, and your lifestyle is what's caused the type 2?
No, never said to me.
No, was it just sort of bad luck or an accident or something?
I don't know that now. But they never mentioned it. I just went to the diabetic clinic and I was put on the insulin and more or less told up it if it wasn't controlling the blood sugar.
Dr. Eva, has the treatment of type 2 diabetes changed so dramatically in the whatever it is? How many years now is it, John?
Well, I'm 8 years with Dr. Eva, and I was diabetic for about 10 years previous.
So in 20 years, has the thinking and the treatment of it changed that dramatically?
No.
Because
this is what surprises me. Even today, I have a gentleman who joined just 3 days ago to come to see me in the clinic, and he was telling the same thing. And people who are newly diagnosed in Ireland are still told the same thing. People are told, oh, it would be good if you lost some weight and you need to start exercising. Usually they say you should start exercising. Very unspecific advice. They are told that you are suffering from a chronic progressive disease. Chronic, you have it forever. Progressive, it will only get worse. You can only manage this with medication. And then you are given this list of medication which typically treats the sugar readings, the blood pressure and the cholesterol, regardless if you have high blood pressure or regardless if you have a high cholesterol level, because it's the cocktail that's given to treat the possible complications that comes with high sugar reading with diabetes. I don't know if it's either that the doctors has not any trust that people will lose the weight and actually cop on and do something, or is it the fact that they are so afraid that if they don't do something on that moment and the patient doesn't start treating the high sugar readings and then they come back after 6 months or a few years with the heart attack, they could be blamed for medical negligence. But whatever way you think, I find this extremely frustrating because I have the most amazing results in my clinics. We give very specific advice to people, exactly what to eat. We give them supporting hand. We take them regularly in. And when a person sees that the sugar readings start suddenly improving without medication, just with the action, what they are doing. It empowers them. I'm nowhere trying to say that this is easy. You want to have the will, but you know the old saying that says if there is a will, there is a way.
Did they stay on insulin while they're in your clinic?
No, you see, this is the other thing. It's almost impossible to expect somebody who's on insulin to lose any weight because insulin is a fat storage hormone. It basically takes the sugar from the bloodstream and deposits it as fat. What is the beauty with the very low-calorie diet, what I'm now written my new book about, is that you can stop the insulin injection in most cases from the start. But word of caution here, this has to happen under medical supervision. So the diet this is we're talking about type 2 diabetes is a serious condition. Medication cannot be adjusted by just anybody. It has to be a medical professional.
Sorry, Dr. Eva, the reason I asked you those questions about whether the treatment of it has changed or whether the thinking of it has changed is because I went on the Diabetes Ireland site this morning, OK? First two paragraphs said, reversing type 2 diabetes is something that is discussed regularly in magazines and on television with stories of people being cured. Now, on closer inspection, all of these stories have a common thread. The people who have reversed their diabetes have done so by losing large amounts of body weight, often the equivalent to 10 to 15% of their total body weight. That's the very first paragraph on the Diabetes Ireland website.
And they changed that since I have actually been having argument with them about this, that their website was totally misleading. Their whole website is very much giving the indication for people that, yes, it's OK, poor you know, just treat your disease with the medication. They are not actually trying to inspire people and tell people, take control.
I'm not going to get into that argument because I'm not medically qualified to get into the argument. But the point I'm making here is that the very first thing they address is diet. Now, how you lose that or what way you do it or what supervision...
But there is, again, a cliche there. There's a thing saying substantial amount of weight, and there's a... basically giving an idea there that you have to be a superhero, superhuman, with amazing willpower. And then there's an example of a person who lost it by doing marathons, almost giving an idea that you have to be able to do marathons in order to lose the weight and reverse your diabetes, because this is the advice that we're giving even at university hospitals. We're telling people the first thing you have to do when you get type 2 diabetes is to start exercising. No! It's not exercise, it's the diet, because it's the visceral fat that sits in the deep abdominal cavity which produces inflammatory hormones. You need to get rid of that. And once you lift the insulin resistance...
And you do that by diet, I'm assuming?
Absolutely.
But, okay. I think we don't have a Diabetes Ireland spokesperson here, but I'm guessing what they would say is it has to be diet under medical supervision. You can't just decide yourself, I'm going on a low diet.
Everybody can do a diet on their own and do diet. What we are talking, what people can't do, start reducing the medication. But the problem is that many of the type 2 diabetic medications have side effects, weight gain. And it's almost impossible to go on a lower calorie diet when you're taking a substantial amount of medication, because the medication drops your sugar readings, you feel hungry, and rightly so, you need to eat, because if you don't eat, you're going hypo. So that's what I'm trying to say. This is a very complicated matter in the fact that, yes, people need medical supervision, but people need the right advice. And what I'm saying is that I have great results. Of course, people who come to see me, they are motivated, they want to do it, and that's one thing. You need to want to do this. But what I'm saying, why we are not offering this at the government level, why don't we give the same advice that I'm giving to private people to everybody in the country? Because not only are we saving money, but we are saving people's quality of life.
I'd say, again, it goes back to resources. Thanks very much, John, for telling your story, and best of luck and best of health to you for the year.